Phillip Inman.
An effective track and trace system to prevent a second coronavirus peak will not only save lives, it could reduce the number of working hours lost to illness by as much as 50%, according to a major global study, writes Phillip Inman for The Guardian's business desk.
The International Labour Organization said the effective testing and tracing of infections was essential if employers wanted staff to return to work and for them to stay healthy.
The Geneva-based, United Nations body estimates that working hour losses can be reduced from around 14% in countries that put in place weak tracking and tracing down to 7% in countries with the highest intensity of tracking and tracing.
With only 4 days until England introduces a testing and tracing scheme to prevent a second peak of the virus, the ILO said an effective system was needed or employers and workers would miss out on much of the benefit of returning to work.
If workers remained wary about the health threats of returning to work, it would leave many vulnerable people excluded and exposed to the threat of redundancy.
More than 400 repatriated Malawian, including more than a dozen infected with coronavirus, have fled a stadium and isolation center where they were being detained.
The 441 people, who were bussed back to the country from South Africa on Monday, had been held while they underwent testing for the virus. 16 were being kept in an isolation center after testing positive, while the rest were being kept at a football stadium awaiting their test results, a local health official told AFP.
They have all gone home on their own, District Health Officer Gift Kawaladzira told AFP. By then, 16 were positive already. Others were waiting for lab results, he said. If most of them have COVID-19, then we are facing very difficult times ahead.
Kawaladzira said his team had mobilized other district offices to track down the escapees. The danger is that they will be hiding from authorities, and hence cannot follow the set procedures for COVID-19 prevention, he said.
Malawi has recorded just 101 coronavirus cases so far, including 4 deaths. South Africa, by contrast, has the highest number of infections of the continent, with more than 24,000 cases and 524 fatalities to date.
In these extraordinary times, The Guardian's editorial independence has never been more important. Because no one sets our agenda, or edits our editor, we can keep delivering quality, trustworthy, fact-checked journalism each and every day. Free from commercial or political bias, we can report fearlessly on world events and challenge those in power.
Your support protects The Guardian's independence. We believe every one of us deserves equal access to accurate news and calm explanation. No matter how unpredictable the future feels, we will remain with you, delivering high-quality news so we can all make critical decisions about our lives, health and security, based on fact, not fiction.
Support The Guardian from as little as $1 and it only takes a minute. Thank you.
Angela Giuffrida.
Deaths from coronavirus in Italy rose by 117 on Wednesday, up from 78 on Tuesday, bringing the total to 33,072, writes Angela Giuffrida, The Guardian's Rome correspondent.
New infections increased by 584, up from 397, the vast majority in the Lombardy region.
There are 50,966 people who are currently suffering from the virus in Italy, down by 1,976 within the last 24 hours.
Italy has 231,139 confirmed cases to date, including the deaths and 101 survivors.
Kenya recorded its highest one-day rise in coronavirus cases on Wednesday, hitting a triple-digit figure for new infections for the first time since the outbreak began.
Today, I come to you with somber news, the health minister, Mutahi Kagwe, was quoted as saying by France's AFP news agency.
Our figures today are staggering. Out of the 3,077 samples tested, we have 123 positive cases. For the first time we have hit a triple digit.
This is the highest number of positive cases we have ever recorded in a single day since we recorded the first case on March 13.
A total of 1,471 cases of COVID-19 have been recorded in Kenya since the start of the epidemic. Of these, 55 have been fatal.
The tally of infections has doubled since mid-May, but the country has also tripled its number of daily tests, from less than 1,000 to nearly 3,000, which has helped unearth more cases.
Among its anti-coronavirus measures, Kenya has a national 7 p.m. to 5 a.m. curfew, which is currently in force until 6 June, and a ban on entering or exiting the cities of Nairobi, Mombasa, Kilifi, Kwale and Mandera.
Alex Hearn.
A security flaw in Qatar's coronavirus contact tracing app put the sensitive personal details of more than 1 million people at risk, according to an investigation by Amnesty International, writes Alex Hearn, The Guardian's UK technology editor.
The app, which is mandatory for Qatari residents to install, was configured in a way that would have allowed hackers to access highly sensitive personal information, including the name, national ID, health status and location data of more than 1 million users, according to Amnesty International's security lab.
Claudio Guarnieri, the lab's head, said the flaws, fixed following their discovery, should act as a warning to governments around the world rushing out contact tracing apps that are too often poorly designed and lack privacy safeguards.
The Qatari app uses a mixture of GPS and Bluetooth technology to track COVID-19 cases and warn people who may have been exposed to an infectious person. Like the UK's app, it operates on a centralized model allowing the country's Interior Ministry access to the information it gathers.
Peter Beaumont.
A medical study in France suggests that even mild cases of coronavirus infection, not requiring hospital treatment, produce antibodies in almost all patients, the body's defenses against the virus increasing during the weeks of recovery, writes Peter Beaumont.
The research, led by a team from the Pasteur Institute, France, raises hopes that everyone who has had the disease could acquire some degree of immunity, although it is not clear for how long or to what degree.
The question of immunity has become one of the most vexed issues concerning coronavirus, in terms of government's public health policies, including the controversial herd immunity route, and in the understanding of the mechanics of the disease, which divides scientists. Early reports had suggested an absence or limited presence of antibodies in some individuals with mild symptoms.
The research, jointly led by Olivier Schwartz, head of the Pasteur Institute's Virus and Immunity Unit, took samples from more than 160 staff from the CHU Hospital, in Strasbourg, who became infected with COVID-19 early in March after a superpropagation event, linked to a 5-day-long prayer and fasting gathering of the Evangelical Christian Open Door Church in Mulhouse, eastern France.
Coronavirus restrictions will be eased in Moscow, the Russian capital, from 1 June, after the rate of new infections began to slow in the city, its mayor has said.
During a teleconference with the president, Vladimir Putin, on Wednesday, Sergei Sobyanin said people will be allowed to take walks at designated times, and he announced plans to reopen non-food stores and services such as laundries, dry cleaners, and repair shops.
Muscovites have been subject to movement restrictions to curb the spread of the coronavirus since 31 March. With a total of 171,443 confirmed coronavirus cases, the accounts for a little less than half of Russia's caseload of 370,000, and about 55% of the country's confirmed death toll from COVID-19.
Sobyanin said the number of new infections in the city has been going down in the past 2 weeks.
Brazil's top diplomat in the U.S. has dismissed suggestions that relations between the countries have been hurt by a travel ban imposed by Washington on Wednesday.
Nestor Forster, Brazil's chargé d'affaires in Washington, told the Associated Press that the ban on arrivals to the U.S. from Brazil was not a setback, not in any shape or form. It's a public health measure confined to that area.
On the contrary, Forster said, the Bolsonaro administration is grateful that the U.S. gave it advance warning of the measure, as well as for gifts to cope with the COVID-19 pandemic, including 1,000 ventilators for the Brazilian Health Ministry and $7 million to fund health services.
We are very appreciative of the fact that, there was some consultation beforehand when the president decided to go forward with this measure, Forster said in a video call from his Washington home on Tuesday.
Jair Bolsonaro, Brazil's president, is an outspoken admirer of the U.S. President, Donald Trump.
Brazil is the Latin American country hardest hit by the coronavirus, with more than 24,000 deaths and almost 400,000 confirmed cases. Experts say those figures are significantly underestimated due to insufficient testing.
France, Italy and Belgium have begun to halt the use of hydroxychloroquine to treat patients with COVID-19, amid questions about the safety of the generic anti-malaria drug, Reuters reports.
The moves by three of the countries hardest hit by coronavirus infections and deaths follow a World Health Organization decision on Monday to pause a large trial of hydroxychloroquine due to safety concerns.
British medical journal The Lancet has reported patients taking hydroxychloroquine had increased death rates and irregular heartbeats, adding to several disappointing results for the drug as a COVID-19 treatment.
The World Health Organization's Director General, Tedros Adhanom Ghebreyesus, has used his statement at the WHO's thrice-weekly coronavirus briefing to outline the organization's call for a green recovery to the COVID-19 crisis.
As usual, his comments are being live-tweeted by the WHO Twitter account.
The World Health Organization's coronavirus briefing is just beginning. You can watch it in the player at the top of the blog.
Helena Smith.
As Greece and Turkey gradually emerge from pandemic-imposed lockdown, fears are mounting of migrants once again gathering at the land border the two countries share, writes Helena Smith, The Guardian's Athens correspondent.
Highlighting those concerns, Greece's Citizens Protection Minister, Makalis Chrysokoidis, visited the region today ahead of some 400 riot police officers being redeployed to the area.
Turkey's Foreign Minister, Mevlut Cavusoglu, is the latest official to have warned that as the country eases restrictions on movement, enforced to stem the spread of the virus, migrants hoping to get to Europe will want to leave. Reinforcements are being rushed by Athens to the frontier tomorrow. Turkey is home to 4 million mostly Syrian refugees.
Memories are still fresh of the crisis that erupted when thousands responded to Turkish President Recep Tayyip Erdogan's abrupt decision to open the gates to Europe for refugees earlier this year. An estimated 30,000 men, women and children, many bussed in by Turkish forces, converged on the frontier with thousands then attempting to illegally cross over into Greece. In recent days bilateral tensions have been on the rise over Athens' declared intention to build a fence to bolster the border, reiterated by Chrysokoidis this afternoon.
Meanwhile, migrants forced to endure prolonged quarantine in a facility in the Peloponnese also took to the streets in protest today.
Greek authorities announced lockdown measures would be extended for another 14 days after 3 more coronavirus cases were confirmed in the holding center, a hotel in the southern town of Kranidi hosting 470 migrants and refugees mostly from sub-Saharan Africa. The hotel has been under quarantine since the 21st of April when 153 people first tested positive for the virus.
Growing disquiet is also being expressed by aid workers over refugee camps having to put up with prolonged lockdowns when the rest of Greece is relaxing restrictions and reassuming a semblance of normality.
We have seen a noticeable rise in all sorts of violence, from tent violence to sexual violence because people are forced to spend much more time in camps, Apostolos Bazis, the medical director of Médecins Sans Frontières in Greece told The Guardian. These people are not treated as human but numbers. The situation for them is utterly inhumane.
Jennifer Rankin,
The Guardian's Brussels correspondent, has now written a report on Europe's COVID-19 bailout plan. She writes,
the European Union executive has called for a €750 billion £671 billion recovery plan to help the hardest-hit countries find a way out of the unprecedented economic downturn caused by the pandemic.
The European Commission President, Ursula von der Leyen, said the EU faced a defining moment, never seen in its 70-year history. The crisis has huge externalities and spillovers across all countries and none of that can be fixed by any single country alone.
Addressing the European Parliament, where MEPs wore face masks and sat further apart than usual under mandatory physical distancing rules, von der Leyen said the sum would be split into €500 billion of grants for EU member states and €250 billion of loans.
Under the Commission's blueprint, Italy would get €82 billion in grants, Spain €77 billion, France €39 billion, Poland €37 billion and Germany €29 billion. The
money would be raised by the EU borrowing on capital markets on a far bigger scale than ever before, meeting a key demand from France and Germany, but provoking opposition from fiscal hardliners opposed to shared debt.